I have been told that I have no sperm. I'm normally ejaculating, my sexual life is normal, but my doctor tells me that I can't have a child. Now, what are my solutions? The fact that you are ejaculating means that only your sexual function or ejaculatory function is normal. Now, kindly remember that penis causes erection, ejaculation happens because of a gland or an organ called seminal vesicle. Testis produces sperm, they both get mixed and come in the same passage. So there is sometimes a confusion that if my ejaculation is normal, if my sexual activity is normal, I am fertile. That need not be so. So you could be normally ejaculating, normally having sexual activity and still be infertile. Now again there is a second misconception that I am healthy, I am vegetarian, I do exercise, I do dieting, and consequently I don't smoke, I should never have a problem. And it is my wife who has a problem whenever fertility issues are there. That is again a myth. A problem can affect anybody because these are problems which can happen to anybody. Now, azoospermia, which we call when there is no sperm, is a distressing condition. Now, the third aspect I would like to highlight is when there is azoospermia, please bear in mind you are most likely looking at alternate methods to have a conception. Natural conception expectation in an azoospermia is a very small possibility, happens only in select patients who have what is called as a hormonal imbalance. If you have a hormonal imbalance, it's possible for you to get ejaculate sperm. But if you have the reason for azoospermia is either hormonal or the testis itself incapable of producing sperm, or the third is a blockage in the passage of the testis. So all these three aspects have their own challenges and it's a distressing condition, but pregnancy can happen even for these people provided you are given the right path and the right advice. Please bear in mind, if you are not keen on a donor sperm, because sometimes donor sperm is suggested as an alternative right in the beginning, but I think you should have a proper evaluation if you are looking for your own biological child, and it is possible to have your own biological child by following the right path, either by an ART technique or by medication or sometimes by surgery. All these three things are feasible. Again, like I said, the idea of this series is to educate you to make a proper choice and an informed choice, and that will help you to make the decision which is least painful emotionally, financially, and is successful.